Liver involvement in autosomal dominant polycystic kidney disease. Polycystic kidney disease, also known as PKD, is a genetic disease that causes cysts to grow inside the kidneys, making them larger and damaging the tissue. Here we can see how the cysts and the kidneys grow and how the kidney function decreases. There are two types of PKD: autosomal dominant PKD or ADPKD and autosomal recessive PKD or ARPKD. In ADPKD, also known as adult PKD, patients don't notice symptoms until they are between 30 and 50 years old. Cysts grow only in the kidneys and rarely in the liver. In ARPKD, also known as juvenile PKD, symptoms appear early in life and cysts grow not only in the kidneys but also in the liver.
This is Emily. She has been diagnosed with polycystic kidney disease, or PKD. Her doctor told her that there is currently no cure and no treatment for the disease. She has lots of questions about PKD, such as who is affected, how is it passed on, and what can she expect. She discovers that PKD is one of the most common, life-threatening genetic diseases, affecting tens of thousands of Americans and millions of people worldwide. PKD impacts men and women alike, and all races and nationalities equally. There are two types of PKD, ADPKD and ARPKD. ADPKD is the more common type, and the type that Emily has been diagnosed with. It is usually passed from parent to child. Children of parents with ADPKD have a 50% chance of having the disease. As a result, ADPKD often affects many people in one family. However, about 10% of people diagnosed with ADPKD have no family history of the disease. Instead, they have ADPKD because of a spontaneous new mutation. For people with ADPKD, fluid-filled cysts grow in their kidneys, causing them to grow larger and larger. Normal kidneys are about the size of a fist. Polycystic kidneys can get much larger, sometimes as big as a football, and weigh as much as 30 pounds each. Eventually, the cysts cause the kidneys to stop working. ADPKD can be a painful disease that keeps people from enjoying life to its fullest, taking a toll on a person's emotional, mental, and physical health. ADPKD is the fourth leading cause of kidney failure, and once a person's kidneys fail, their only options are dialysis or a kidney transplant. The other form of PKD is ARPKD. ARPKD is a rare form of polycystic kidney disease that occurs in 1 in 20,000 children worldwide and can cause death in the first month of life. For children who survive the newborn period, about 70%. About 1/3 will need dialysis or a transplant by age 10. Every action makes a difference. Visit pkdcure.org to learn how you can help.
Although the majority of patients with ADPKD don't present liver symptoms, some might experience chronic manifestations related to polycystic liver. The cyst can also affect the biliary duct. Some treatments that the patient can have are liver transplant or resection.
Look at the disease itself and find out what ADPKD does to your body. ADPKD can cause problems for many parts of the body, including the liver, the pancreas, the spleen, the large intestine, the brain, and the walls of the abdomen, as well as the heart and blood vessels. What are the signs and symptoms of ADPKD? When signs and symptoms do begin to appear, people with ADPKD may notice things such as back or side pain, an enlarged abdomen, or blood in their urine. They may also develop high blood pressure and experience frequent urinary tract infections. Thinking ahead about disease progression can lead to feelings of anxiety and worry. ADPKD may even impact some people's decisions about whether or not to start a family.
Fortunately, there is treatment for liver involvement in case it happens, which is not very common. Also, the patient can have both kidney and liver transplant. And in case of kidney failure, the patient can have dialysis. Unfortunately, there is no cure for PKD. Family members have 50% chances of getting ADPKD. It is the fourth leading cause of end-stage renal disease and its symptoms appear late in life.
It is caused by the genetic defect of PKD. Somehow the polycystin proteins are involved in the control process, and you switch to an abnormal phenotype in these cells where they proliferate, enlarge, these cysts grow in the liver just like they do in the kidney. And not only that, but the fluid is secreted into these cysts which bud off the biliary tree, similar to the way it is in the kidney tubules, where the cysts eventually bud off the kidney tubules and are out of control. That actually is the situation for most people with this disease, with PKD, that they have a few liver cysts or one or two liver cysts. They never even know about it. But in fact, data from the CRISP study, an NIH-sponsored study here done in the United States, using MRI scanning in people that had ADPKD, it's a very well characterized group of people, in people aged 15 to 24, the prevalence of liver cysts was 58% using MRI. The prevalence in people aged 25 to 34 was 85%. And in people that were in the age group of 35 to 46 years, the prevalence of liver cysts was 94%. So overall, people probably never find out that they have a liver cyst, but they are there if you look at highly sensitive methods of imaging the liver. We can consider very rarely in people that have severe disease liver transplant. This is a major surgery because usually the existing liver is very large and needs to be removed. And so there's usually issues with bleeding more than in other diseases where people undergo liver transplant. So again, that can be considered, but you should seek out a specialty centre experienced in managing patients with this condition.
In Ecuador, a study made by a group of doctors in the Metropolitan Hospital in Quito showed the next results. The age of patients that presented PKD was around 50 years old. 33% of them were men and 66% were women. 83 presented family history. In addition, 16% presented liver involvement and 83% both liver and kidney involvement. 83% referred abdominal pain, 60% hepatomegaly, and 33% early satiety, heaviness, or back pain. conclusion, PKD is a disease that affects millions of people worldwide and has no cure. PKD can affect many organs beside the kidneys, including the brain, the heart, intestine, causing what is known as polycystic liver disease or PLD.